and we're absolutely thrilled that you're as interested, hopefully, as Dr. Berda and I are in this new course that we're launching from ICU DDR, but also specifically the content of that, which is the role of the nurse. So what we're going to do today, just which you should see on your screen now, is an outline. We're going to give you a little sample, a little taster of what this new Universal Nurses Addiction Curriculum is going to be offering. And we decided to focus, although it's a very wide curricula, what we've decided to do is just introduce a little bit about the role of the nurse and why we think nurses have a unique position to play and indeed are part of the response framework and certainly a key member of the multidisciplinary team. And we hope that you will share that with us. So Dr. Bird is going to take you through a little bit of that shortly. Then we will give you the course at a glance. So we'll give you some further information about what you can anticipate and expect. And then particularly, and hopefully of great importance, is what then? What do we want you to do? And we hope that you're going to say you certainly want to join us and that you would want to take this course, and we'll give you all the information with regards to that. So really delighted now to hand over to Dr. Berda, my partner in crime, so to speak, who was the co-developer, co-writer, a wonderful colleague and friend. So Dr. Berda, over to you, please.
Thank you. So we're going to talk about the holistic nurse, embracing addictions care in every setting, which is something we don't see very often. So this is part of the Universal Nursing Addictions Curriculum. It's the foundation. And this is the online version that we're going to be selling to you, inviting you to today. Next slide, please. To nurse is to be human. And a favorite saying from Nutting and Dock in the history of nursing from 1907, no matter whether this treatment is carried out by sorcerers, priests, doctors, or old women, we find examples of the historic ancestry of modern nursing and the earliest forms of its art throughout history. We are part of this, and we want to bring that forward. Next slide, please. There are 28 million nurses in our world. We comprise half of the global healthcare workforce and provide approximately 80% of all the hands-on care. Nurses often serve as the initial point of contact for patients and may be the sole healthcare professional that a patient encounters. Nurses are at every stage of the continuum of care, and we play a crucial role in the country's capacity to address health priorities due to their multifaceted contributions. Nurses are central to addressing current health challenges, including combating disease, addressing antimicrobial resistance, and responding to health emergencies and managing pandemics. We're frontline. Nurses have evolved into advanced practitioners capable of diagnosing, prescribing, and treating patients. And contrary to common perception, nurses undergo extensive education, including at the degree, master's, and doctoral levels. Next slide. So we are in multiple roles throughout the healthcare process. We are clinicians, we're managers, we're leaders, we're researchers, we're educators, we're consultants. We are an educated professional group, and we need to be able to broaden our own sense of that role everywhere we work. So nurses provide care and leadership to address global health challenges everywhere, often at great personal risk. They are essential life force for health, yet our healthcare systems worldwide have fallen short and failed in the value to protect, respect, and invest in the precious resource that we are. The world has taken nurses for granted, treating them as invisible and inexhaustible resources. It is now painfully apparent, post-pandemic especially, that we are endangered by the lack of respect and the investment needed for a strong and enduring and sustainable workforce. So we have a couple of key drivers that you may or may not know The World Health Organization has a wonderful resource for us and a lot of support. Global Strategic Directions for Nursing and Midwifery, the International Council of Nurses, the ICN, and Guidelines on Mental Health Nursing's State of the World Addressing Nurses in 2025, who are investing in education, jobs, leadership, and service delivery. And the big meeting was Geneva World Health Organization in 2025. All of these are resources we should all be utilizing and joining in order to maintain support. And now a short film produced by another resource, the International Nurses Society on Addictions. Carmel was actually president and I was on the board for many years. And this is a film that we developed while we were on the board, and we'd like to share it with you today. Don't hear the sound.
Great. Thank you, Karan. Oh, I'm starting it again. No, we don't want to do that. So thank you. That's really great, Dr. Berda. Hopefully you enjoyed that, but also hopefully you have heard particularly why perhaps Dr. Berda and I, and along with many of our other colleagues, wanted to get this particular course off the ground, why we recognize that nurses don't necessarily come to mind as the frontline addiction person, but I hope that what that short intro from Dr. Berda has helped sort of consolidate for you is that actually nurses are everywhere. And I think for us, that was a key aspect of one of the things when we were asking, particularly from our colleagues in INL and Columba Plan, why they should invest in a specific course, particularly through the universal curriculum. Many of you will know that there are the universal curriculum for prevention, for treatment and recovery, but these are actually quite generic courses, not specifically. So this particular course that we have written is dedicated to the profession of nursing. That doesn't mean that nurses are the only people. We know that for certainly that's not the case, and indeed we wouldn't advocate. It is very much a multi-agency, multidisciplinary response that's required. But I hope that you will expect, as you listen more and further to what we're describing, that with 28 million nurses, which you've just heard, I'm not sure if that's new information to you, but that is a phenomenal workforce that we really should be tapping into. But we recognize that nurses are not necessarily the first go-to person or indeed recognized. Dr. Pam Cipriano, who is the immediate past president of the International Council of Nurses, in actual fact said in the launch of this particular course in June that we need to move nursing from invisible to invaluable. We really loved that statement and that passion, and we hope that you're going to pick that up. What we'd like to do actually now, we have a very large group with us, hopefully listening. There's about 85 of us in this particular webinar. But what we thought we'd like to do with you now is to do a poll. So if you bear with me, I'm going to try and, because I'm maneuvering so many different pieces. So hopefully I can end here, get to our launch up here, if I can do that. And I should be able to launch a poll quiz. And what we're going to ask you guys to do now, if you wouldn't mind, and if you would play with us for a moment, is we've got 4 questions that we're going to ask you. It's anonymous, so you will be able to respond. And there's 4 questions that you will see that we're inviting you, and there's a drop-down menu you can choose from. There really is no right or wrong answer here. It's really about your experience, where you're responding from. Some of you will be in countries where the role of the nurse really isn't fully appreciated within this particular sector. Some of you may indeed be, already engaged in advanced practice around addiction. So please do not feel that your answer is in any way right or wrong. But what we're hoping to do is we're hoping to get a sense from the results, which will come up automatically, to see what is the wide global experience that we're seeing today. So here you can see we have a quiz, so you can see the 4 questions. I hope that those are coming up. Let me know, Verna or Karan.
Not yet.
Not
but
yet?
I can share it from my end.
Can you share it from your end?
I see it.
You see it? Thank you very much. Everybody can see it. So there are 4 questions. The first, as you're taking a moment to respond, the first is, which of the following best reflects common nursing attitudes towards individuals with substance use disorders? And we're asking you to sort of give your perspective. If you're a nurse, you may feel more comfortable because it's your community of practice. If you're a non-nurse, I still think please do respond, because you will be working alongside nurses, I'm sure, as part of your everyday practice. So what would you say is your general sort of sense of that? So we're already getting some people responding, so thank you for that. Please continue to do so. Once you've answered the first question, continue to make your way through the poll. So if I can move it up, you'll see the second question: which of the following best reflects your own feelings when caring for individuals with substance use disorders? And what we're trying to differentiate there is that there may be a professional attitude, which often we recognize. And so you would say nurses feel or have an attitude towards substance use in this way, or doctors generally can be responsive like this, or psychologists or counselors. But we're also very interested perhaps in your own personal perspective, which we also recognize could be incredibly different to your community of practice or professions perspective. So please do respond to those differently. I can see we're getting some great traction. Thank you for that. The third question that we have is then really just trying to get a sense in your country. So where you are currently working and residing, in your country, is addictions nursing formally recognized as a role or specialty? And what we were trying to understand there is that people may be working in the field of substance use disorder as a nurse, but it may not actually have a specific title or registration, or indeed even specific specialty recognized by your country or your nursing council or board. So we're interested to know whether you're aware of that, whether it is recognized. And again, we know, for instance, in the UK, we do have addiction nursing as a particular role. But talking with my colleague, Dr. Berta, she said it's not actually recognized in the US as a specific role in that respect. So even in between the US and the UK, we know that there are differences. So we are anticipating that's going to be very different across other parts of the globe also. And then, of course, we're very interested in where is addiction training and whether it's included in pre-service or nursing education programs, because perhaps the reason that nurses are invisible within this sector, or maybe that they're not leveraged, in the way that both Dr. Bird and I believe they should be, it could well be that this is the absence of training. And if you are not exposed to substance use education in your pre-service education as a nurse, why would you then think that this could be part of your professional role when you go out into practice? So interestingly, we're getting some really nice responses. We've had about 55 people respond to us on these questions. So I will scroll back up and then you can sort of see the answers here. Hopefully they're coming through. So we can see here, we have actually out of the first answer, looking at this for the moment, it looks like we're having quite a natural bell curve, actually, in the sense that it oscillates between, or you certainly have some outliers from frustration or resentment through to empathy and advocacy. So quite nice. A little bit.
We can't see the results. We're still seeing.
So let me end the poll. So thank you very much. I'm going to end the poll and share the results. So let me hope. Are they coming up now?
Yes. Yes.
Fantastic. Thank you so much. Thank you, Karan. So here in the first response, so we've had about 60 respondents to this, which that's a great number. And as you can see, the answer to the first is we have 12 out of the 60, so 20% telling us that there is frustration or resentment, believing patients are responsible for their condition and difficult to care for. That doesn't surprise me. Fear and discomfort, again, 15. So if you take 35%, including actually over 40%, who really are on the negative aspect of that, from hopelessness to frustration, resentment, and indeed fear. That's quite a big number if you then extrapolate that to the wider 28 million nurses that we've talked about. But then up to another further, which is nice to see, we have about, what's that, 56% who are either compassion with caution or viewing patients as individuals deserving dignity, which is great to see that also. But that is not surprising to get that result. We see it right across our profession. Which of the following best reflects our own and perhaps anticipated? We have within a community that are coming to a webinar about and interested in the role of addictions, SUD, and nurses. I would be surprised if it wasn't more towards the positive, in the sense of committed and confident and wanting to care. But I do think we need to recognize, as you can see, that we still have over 20% who are struggling a little bit, frustrated, and indeed sometimes feeling uneasy. So if we are to assist and support our colleagues, what is it that we need to be doing to make sure that we can shift that dial for them also? And then in the country, interesting results in terms of addiction nursing being recognized. As you can see, only 10% say yes, it's a specific role. So there's lots to do here. And some people unsure, but we can see the majority, 45% no, but nurses are often working, and 23% no, but there is no recognition particularly. So therefore, a quarter, give or take, of our population that are responding to this. And if we take that again out to the wider community and extrapolate, quarter are not even seeing the role of nurses at the moment as being useful. And
then we're not seeing the results changing as you read. So we're still on the first question.
Oh, I don't know why that is. Forgive me. Verna, do you know why that is?
I think participants have to scroll themselves.
Thank you. So if you scroll, as I'm scrolling though, it should be showing, I would have thought. So, but what I'm telling you here, hopefully you're hearing the results, if not necessarily visually seeing them. I hope that is helpful. And in the finals, we say about addiction training included in pre-service and nursing education program. And what we're getting here, yes, it is part of the core curriculum, 15%. Yes, but briefly touched on as another subject, 33%. But yet again, we have a not sure at 5% and 47% no, it is not included. So again, over 50% of our sample are saying this is not being addressed in nursing curriculum at the pre-service level. And to be quite frank with you, that does not surprise us. I'm going to come out of the poll, if you would allow me for the moment, and go back to sharing. the link of the poll. And that doesn't surprise us. And indeed, those of you who will know, and we will share this as a link subsequently, that the WHO have done a beautiful, in actual fact, we had a webinar launch during the summer with our colleagues from the WHO, a beautiful guidance document for universities and higher level education to how they can actually translate the curriculum for addiction into and embed it into undergraduate pre-service nursing and medical students curriculum. So if you are not aware of that resource, we will certainly share it with you, but please do check out the WHO website for that, because it gives you a step-by-step guide as to how you can embed addiction into pre-service nursing and medical student education. So in summary, I'll pick up the first couple which you've kind of heard, and it's almost like you could say we've done this poll before, because we were able in some respects to prepare this slide. But I think that what this demonstrates to you is that the findings that we have seen in our sample are reflected generally globally, in that this tends to be the response. So you can see that in terms of overall, responses often show a mix of frustration, fear, and hopelessness, but you do get that some elements, of course, and one would hope for that. It's just popping up again, forgive me. Alongside compassion and advocacy, this reflects the reality. We know stigma and bias are widespread, and many, many nurses also want to help, but attitudes get in the way, act as barriers and motivators to care, and we'll come to that again in a moment. The personal reflection on attitudes, participants may report more positive, nuanced attitudes about themselves compared to how they view nursing in general. This gap is powerful because it shows stigma may feel more like an external issue, but personal biases still matter. So even though we know that we come into nurse and to care for everybody, our own inherent biases can actually have a powerful role to play, and we have to be incredibly mindful that we are keeping that in check, and that we do engage in lifelong learning to be able to address that and ensure that our practice follows. Karan, would you like to pick up the other 2 points?
Yeah, I think, what we're seeing in the poll and what we're pointing out is really the motivators for why we're here and why we keep working at this. Our responses show that there's a mix of frustration and fear and hopelessness, along with compassion and advocacy, but we really want to get all nurses to feel as comfortable in this so-called chronic disease as they would with any other chronic disease, and kind of really look at the stigma and the bias that's widespread, and some of the attitudes that get picked up working in certain environments that nurses kind of adopt, which we find is against evidence-based practice. We know that when we educate people in addiction, attitudes change and outcomes change. Patients get better when their practitioners are more educated in the process of their recovery. So addiction training is really important. Likely to see lots of gaps in the way people are educated. They might get a little bit when they do mental health. They might get a little bit in pharm, but really not a whole lot across the board in most countries. And very limited training adds to a lack of confidence and more stigma. So we are here to help bridge those gaps, and I know we can. One of the big problems is the lack of faculty to teach this course. So
Right.
there's where we are, and this is the need that we're trying to fill, the gap we want to see go away.
Great, thank you.
Education. Yeah.
Yes, so yes, just moving on to those barriers. So just to reiterate, you can see education. You may expect, obviously, Dr. Bird and I to say that we've been around the field for combined, I think probably
Too long.
I hasten to add actually our combined figures, but we're certainly heading up into a good 70 to 80 years between us in the field. And as educationalists, you would expect us to say education, because we all know lifelong learning is something that we have to be passionate about, and none of us knows everything. And I think certainly one of the benefits of getting older is you actually recognize you know very little. The older you get and the longer you're on this planet, the more you know you have to learn so much more, which keeps it all very interesting. But let's talk a bit about that. I mean, you know, Karan has just mentioned as well that we know that there is a lack of education content. I mentioned that the WHO have done an amazing new resource. We really highly recommend this resource to you, particularly if you're in the field of education yourself and you're sitting wondering as a tutor or as a lecturer or as a dean, you know, what could I be doing to shift that dial and to expose our nursing students to greater education in this subject. We certainly highly recommend you to and direct you to that resource. But we do know that there is really absolutely very, very insufficient preparation at undergraduate and indeed postgraduate. And any of you know that. Maybe that's why we get such great turnouts in our webinars, because we know there is very little, and we also know it's very expensive, and accessibility is a huge issue. We also recognize taking time out when you're working and you're trying to balance your lives. How do you access that? And we know through a range of studies that the course of over 30 years, really, we're not seeing that dial shift in the way that you should anticipate, given the public health concern that addiction is and how ubiquitous it is, how it crosses every barrier that we can imagine, whether that's, you know, race, ethnicity, culture, you know, country. It really is indiscriminate. And so therefore, to us, it is surprising that particularly when you think about nursing being such a ubiquitous profession and the largest global healthcare profession in the world, how this is not central and core to training still surprises me today. And what we do know is that the attitudes and support are great. And you may or may not be familiar, but this is some work that came out, believe it or not, seminal work from Shaw et al. On alcohol, and why particularly professionals, not just nurses, but any professional really, does not engage particularly in looking after people with alcohol-related dependency or concerns. And they identified this sort of constructs of that really you need something around role adequacy, role legitimacy, and role support. And what they meant by that is that role adequacy is I need to feel adequate. I need to have the knowledge and skills. If I don't have the knowledge and skills, I'm going to be reluctant or hesitant to engage. If I don't feel it's my job, and we've just hopefully demonstrated, if it's not in your training at pre-service, why would you think it's your job or your role? So you don't feel it's legitimate for you to, in actual fact, engage in this work. And then, of course, if you don't have that infrastructure, or you don't have mentorship, or you don't have, you know, mentors, people who perhaps know something and are specialists, if you don't have that and that role support, then you again would be fearful and wary to start engaging in an area that you feel less confident in. So these three really interplay with each other. And we recognize that you need all three, actually, if you're going to get a professional to feel comfortable and confident in order to engage and work with this particular client population. And so for you to reflect on that might be helpful. At this moment, do you feel that I'm not feeling completely adequate? I do feel it's legitimate, and I'm not so sure about my role support, then you could perhaps understand why you may not be at this point as actively engaging in substance use care or indeed practice. So don't underestimate the power of stigma, of course, as other factors. Karan had already mentioned we lack the nursing faculty, and indeed we really, if you're a lecturer or a tutor and you don't know about this subject area, is it likely that you're going to include it in your training? Most likely not. We have the absence of clinical specialists and field mentors, and we really have very limited opportunity for placements and clinical practicums. So all of those combined, coming together, really do put us on the back foot. And certainly one of the reasons why we're hoping that you'll agree with us that getting a course like the Universal Nurses Addiction Curriculum up and available and accessible is going to be, we hope, super important and really going to help us bridge the gap. So Karan, just to summarize where we see the nurse's role, perhaps.
So the nurse's role in addressing substance use and supporting our individual patients that have substance use disorders is in the screening and the assessment, where we start in all nursing, right? Assessing our patients, conducting thorough assessments to identify substance use disorders and associated health issues is key. And there are some really good ones that we will review and teach you how to utilize. Also, providing education to individuals about the risks of their substance use, harm reduction strategies, and available resources for treatment. A lot of people who are using these substances may not have hit on the primary physical downfalls, though they'll eventually have to address in the future. And knowing that ahead of time and being educated is a really important thing. Also, the counseling and emotional support to the individuals and the families, addressing all of the concerns and providing guidance through the whole recovery process. And then again, collaboration, using an interdisciplinary team, making nurses part of the interdisciplinary team because you've utilized new skill sets that give you more information and how to move someone from despair to recovery, and developing comprehensive care plans that include their substance use, which we often ignore while looking at abscesses rather than looking at how they got there in the first place, always going back upstream. So these are things that we do all the time, day in and day out. Screening, educating, counseling, and collaborating, but not always in this realm of addiction. Advocacy is another really big part. Advocating for policy and programs that promote access to treatment. Even in SBIRT, if you don't have treatment, you can't provide the whole screening and referral. The referral is key, and that is a systems approach to getting treatment, reducing stigma, and supporting recovery. The referral and having the good referrals. One of the downfalls in nursing is we refer people, but we've never been to the referral site. We don't really know what we're referring them to. We don't know how good it is. So having good knowing and having relationships with referral sources, detox programs, rehab centers, and support, we know like where the good ones are, where they're going to be bridged into recovery. And then follow-up assessments and providing ongoing support to prevent disengagement is really important. As in all nursing and healing, we need to have providers that have an eye on us throughout the process. We need to be connected. We need to have relationship. Therapeutic relationship is key with this population. And then to top it all off, you need to have your own self-care and prioritizing that in order to maintain your own physical, emotional, and mental well-being while supporting others is really key to maintaining. This is not a sprint. It's a lifelong process. Carmel and I are here to show you we're surviving it, but we have to do a lot of self-care.
Yeah. So hopefully what you're starting to see and really what we're going to now try and take you into is a little snapshot and inside the course. And having seen actually what Karan has just outlined, what is the role of the nurse, you're going to see a lot of that reflected in terms of the curriculum that we have developed. And indeed, just what Karan has said, there is an actual fact, an entire whole piece that we spend a lot of attention on about how you look after yourself and supporting yourself. And I'm pleased to say we didn't do it on our own. I hope you'll recognize, even though Karan and I have been around a lot and we may be a little bit self-opinionated that we know a bit or so, but we recognize also that you don't do this on your own. And we also, when you're trying to set up a global curriculum, certainly my experience is largely from Ireland, where I was originally born and come from, and then the UK. And of course, Dr. Berta is from the US. And we both feel that, you know, obviously our experiences, although we have some understanding internationally, will be largely influenced by our practice over the last 30 odd years within those countries and within those systems. But so we're really very, very pleased to know that we were delighted to be able to engage, as you can see on your screen now, a host of experts from right across the globe who informed us and watched every step of this progression of the curriculum. They were back and forth. We piloted it in Greece. We had 7 modules to start with. It's now down to 5. They've told us, no, don't do this, do this. So we need more of this. This would be not something we would do in our region, or this language doesn't feel appropriate, etc., etc. So we had a really dynamic engagement with the colleagues. And as you can see, so we had representation from Latin America, or South, certainly Brazil. We had the African region, albeit just Nigeria, but you know, I know my colleague in Nigeria would also be and was talking to many other colleagues within that continent. We had a European input, as you can see, from Portugal, the Netherlands, with Mr. Paul de Buff, who also is both Dutch and from UK. We had, of course, Ms. Hanandi, who is the chief senior nurse out of the NAFOR treatment center in Doha, not necessarily originally from there, so has a much broader experience of that region. We had Dr. Peter Kelly from Ireland, and I'm very pleased to say we also had representation from India. So we feel, you know, it's not perfect. I'm sure that as we continue to evolve and develop the curriculum and have input from our participants, we will continue to learn together. But we feel that we managed to capture a flavor and voice from across the globe as to what would be required as a minimum to introduce into the curriculum. And then you can see, I'm not going to belabor these points because I think we've kind of covered it already, but we all sort of know, and I certainly believe we have a very expert group listening to this webinar because of your interest. We know that this is a massive public health challenge. We know that the numbers, although in parts are stabilized and some are doing better than others in terms of regions, but overall, this is still a massive crisis for us. And we certainly know that it's not going away. And if we're really genuinely going to shift and turn the dial, we need to be giving a lot more attention and input. So it is an imperative that we start to build a workforce that is evidence-based, but we recognize that you don't have to be expert. I think hopefully at the beginning you saw, we said every nurse is an addictions nurse. When we say that, we're saying that you don't have to be at the specialist end. There is so much that can be done in the early stages when people are starting to perhaps come up and against with self-soothing in terms of using substances, that nurses can be having those initial conversations in the ER department, in the A&E department, in the medical wards, in the follow-up clinics, when somebody may have fallen over because they were intoxicated and are now back in the fracture clinic. What is it that the nurse could be doing and communicating around substance use in those places? What could school nurses be doing with young people in terms of engaging in opening conversations, both with mental health, but also with substance use? So nurses really will find themselves in every part of our community, and there is a conversation to be had with wherever somebody is in that continuum of care. And these really are the voices we really want to emphasize. It's about co-creating this curriculum. It needs to be credible, and at its heart, as you would anticipate and expect, it has to be compassionate. So we're about cultivating understanding, strengthening all nurses' abilities, as you've heard, and then particularly empowering the nurse to take their place at the table. We have some underlying values. I'm going to move forward because we do want to have some talk, but this is really just a very nice piece where you will see that this is kind of the branding that goes with our course. And we had a student actually from my university, a finalist, who purposely made this brand for us. And believe it or not, and coincidentally, he was a Brazilian chap, but both his parents, we did not know this when we selected him, both are nurses. So we really thought that there was something aligning, if you believe in that, that we had picked the right person to do the brand. But please, when you get a chance, just read that. We're also so if you want more information about the launch, and the reason we're putting this up with the link is we really would love you to listen to Dr. Pam Cipriano, who is the immediate past president. She has been an ardent supporter of this course from the very beginning, and has been super, super kind to us in terms of guiding and coming and certainly listening to what we're trying to do. And she makes a passionate plea really about the role of nurses in this space. So if you would like to hear her voice on this, please do check out the YouTube launch, and you can scroll to about 7 minutes in, and then you'll hear about 13 minutes of Dr. Pam Cipriano talking about this. We also wanted to recognize that in addition to INSA, which we introduced you to, which is a specialist addiction nursing community of practice, but there is also, and many of you will recognize ISUP, it's one of our sister organizations. And we just want to put a shout out that, of course, the International Society for Substance Use Professionals is super. You can join as an individual for free. And there is actually specifically an ISUP nurses network. And we've given you the link to that if you would like to just engage with your fellow colleagues on that. So Karan, do you want to mention about the bit of pre-work people might want to also do?
Yes. So, we're jumping in and giving 15 weeks of education, but this is not superficial, and it's based on foundational knowledge. And we would expect that you would complete the UTC-1 basics, introduction to the science of addiction, and have that knowledge before you start the course. It'll help you with the orientation. We'll be able to just start running with more ways for nurses to work competently. But it requires that you have some foundation understanding of the science, and it gives you an overview of the physiology, the brain disease, the pharmacology of psychoactive substances and whatever. But it's a good starting place. So we would highly encourage, if you would like to take this course with us, that you come prepared by allowing yourself to use this free course to get the foundations under your belt. Would be a great start. So we created a whole study guide with a weekly commitment. It's very self-paced. We're expecting about 3.5 hours per week of study over the 15 weeks. There'll be a study guide for every level, which we also call module, but module or level, whatever you say for that. And we're going to stay consistent and balanced. We're going to keep pace with the weekly content in order to be successful. It's very manageable. And we know that everybody's working and doing 50 other things, but we think 3.5 hours a week is doable. These are the titles and the objectives for each section. There are 5 levels. So the holistic nurse, which we talked about today, why this training is important, describing the key drivers, a lot of it will go into detail, exploring our involvement and how we can work. The addiction for the basics in nursing practice, going over the types of addiction, being able to recognize when people are in trouble, what a disorder is from just use, acknowledging why people use, looking at the barriers and identifying the resources, and how do substance use, how does it affect your individual holistic health? It's a really important piece that a lot of us think we know, but I think when we go into detail, it's quite comprehensive. Then it's all about the relationship of nursing. A lot's about trauma-informed care, navigating the stigma and the tense encounters, how to deal with tense encounters. We're going to teach you how to de-escalate, how to use certain language and skill sets that kind of join in the patient's frustration rather than being fearful of it. And we have years of experience doing that. I'm not saying you should put yourself in danger. You should always have supports around, know what you're doing, and we'll show you how to start those difficult conversations and behavior changes. Then expanding your role and your responsibilities just by looking at the screening and the brief intervention. If you had a short little screening that you could use in your organization, that's a good place to start, to have them agree to that, having to have parts of this information in your assessment tools would be helpful. Are they using substances? What substances are they using? How deep are they? Those kind of things. Learning the assist tool, learning Expert. These are, you may or may not be very familiar with these screening tools. And then integrating all of it into your practice. How do you do that? How do you take this new information in this busy practice that you already have and add more to it? That's the last thing any of us really want to do. But how do we be ethical and using evidence-based interventions and then adding self-care on top of it? It really isn't that much more to add. It's just a way of responding differently and then being able to have the resources behind you. This is really exciting, changing work. It'll change you. It'll change the way you practice. We've already taught it. We're going to teach, we're teaching it face-to-face in pilots, and people come away with lots of positive responses and just how they can do things a little differently that they've been doing for a long time. And it's making a difference, which is for us, the gold. That's what we go for, making a difference. So we have sample scheduling. We're starting on October 20th, which is week 1, with these 5 core levels over 15 weeks. Everybody stays together. It prevents overload. We're trying to build community. We have our past students are on WhatsApp, and they're also on the ISAP site. They're all sharing information. You know, our globe has gotten very small, and we need to be together. We need to be together so that we can recognize each other. Within these 15 weeks, I have to say it is over holiday, winter holiday, and we have weeks that we are not meeting, but you could stay on course by continuing to do some work behind the scenes and then jump right back in. And we don't want to leave anybody behind, so we'll be there to support you also. I really look forward to working with you. I think what we're doing makes a difference, and you can be a part of that at the grassroots. So come on.
Come and yes, come and join us. So one of the things which we're really very excited about is that even though we have presented and we know how to do this course in person, and that is available still if people would wish, this is going to be an online version. It's going to be synchronous and asynchronous, and so you will have opportunity to meet with each other online through Zoom, but you'll also do self-paced work, as you've just heard. One of the very exciting differences, perhaps, is that we have actually engaged a new platform called MyQuest platform. And this learning management system is really about bite-sized learning. It's about keeping you engaged. It's about the experience. It's a really fun environment, and we're really excited to introduce it to you. We're currently building the course at the moment, and it'll be ready, as you've heard, by the 20th of October. But after this particular webinar, we will send to everybody who has signed up for the webinar a link to a demo site. So for free, you can go onto the demo site, check it out, see if you like the style and the way that we engage people. But the idea with MyQuest is, and the reason we've chosen this platform, is they gamify learning. So there's kind of a fun element to it. It's all very bite-sized, short. It tells you how much time you need to do certain exercises. There is a coaching element. There is an AI feedback, so you get a responsive, immediate feedback, both from myself and Dr. Berda, but also directed through the AI system. And really what we're saying is that we're far more interested in your learning experience. The content we know is good, and we know that it should land, but we're really more interested in making sure you feel comfortable, feel a sense of energy and fun as you're learning, and that you stay the course and not just engage at the beginning and then disappear. Really important that you stay the course. Hence why we've made it so that we're really not anticipating any more than 3 hours, 3.5 hours a week, and that would be divided over that period. You'll have lots of stopping points to reflect, you'll lots of videos to watch, and then obviously coming into live class sessions. And there's lots of skills work as well, which will get you to practice back with some of the tools that we'll be giving. So we hope that you'll enjoy that. The other element, of course, which is exciting, is that it's not just only about learning, but maybe about validating that learning and recognizing and sharing that, so that people know that you have achieved. So we have now added to the suite of the ICAP credentials, a brand new certification, which is aligned with this particular course, and it's called the ICAP Registered Nurse, RN. So people who take this course will be eligible to register for the ICAP RN. So in the early part of 2026, if people have taken the arc of the training successfully and feel prepared, they would be very much encouraged and invited to take the ICAP RN credential exam as well. So what do you do now? Hopefully we've got you excited. Hopefully it's of sufficient interest. We really are calling you to action, not only you individually who are listening as wanting to perhaps take the course, but if you're an educator, if you want your colleagues to come along with you and get excited, then here is the opportunity to hopefully share with us and put out the message that this is now available. One of our key missions, I hope you would recognize through ICU-DDR, really alongside, many of our colleagues also in ISAP, is central to that is equitable access. And we're really super aware that where you actually currently work and live has implications as to whether the affordability, the time, and potentially economic costs to taking training. So we have now set up a fee which is stratified according to your country's location. So if you are in a lower income country versus a higher income country, that has been taken into consideration. So when you apply, you will be directed accordingly to wherever your residence is. And hopefully you will see that there is an affordability that has been attached to that we feel is very realistic and will allow you to engage with us. We are also looking at other sponsorship opportunities, but please do reach out to us if that is a problem. We also, as I said, will be putting out a taster bite session through MyQuest demo, and that will be coming out to you after this webinar. And of course, if you have any particular direct questions as a result of what we've shared today, you can send it to training_requests@ICU-DDR. And I'm going to finish here. If you want the QR code, if you now look at that and take a snapshot of the QR code, that will take you directly to the application form, which is an online, it's a very simple application form, and it will immediately take you through into applying. We are looking for the first 30 applicants for the first cohort, which will start 20th of October. So please, there probably will be a rush. So if this is something you really want to do now and feel ready, please do not delay. And of course, if we are oversubscribed, which we strongly suspect we will be, then we would put you on a waiting list and we will then be running. And we intend to continue to loop this training. So please don't be put off by that. We're hoping to actually also do a train the trainer course. So if you're interested in becoming a trainer, do also contact us directly at Training Requests, because we will be putting together a pool of trainers who means that we can then offer this course online with multiple cohorts. If you're also interested, and not necessarily as an individual and you are an employer, so you are currently a hospital chief nurse, or you are running a service, or you're a university or an educational provider, and you think, I really would like to have this course bedded into my institution or into my hospital, and I would like my staff to have to be able to take this as a cohort, then we are also able to do that. That's one of the benefits of the platform that we have now aligned with, that we can actually take the entire course and drop it in as a subdomain into your organization. So if you're interested in taking it and dropping it into your own university alongside other courses, or into your institution, then please do contact us directly, call trainingrequests@icuddr.org, and we can then set up a meeting to discuss how that would be feasible and possible for you. So that's where we've got to. I'm going to stop. We have, I think, about 5 minutes. If there are any immediate questions or if things have come up in the chat, then I'm going to stop sharing, and maybe we will be able to take 1 or 2 questions that we have from colleagues. So we hope that you've enjoyed this really 1 hour flying visit to what we're hoping and intending to do. But thank you for your attention, and happy to take any reactions, questions, and maybe Verna, you've picked up some chat yeah.
Yes, so there's a question whether UTC1 is a prerequisite.
No requisites at all. The UTC1, we really just highly recommend. I don't want to put, and neither does Quran, we don't want to put any barriers to education. So if you feel that you have enough knowledge already, and you feel capable, able, you could take the UTC1 in parallel with taking our course. So if you have that extra 20 hours, as you know, the UTC online, UTC1 is self-paced. It's not instructor-led. So you just register and take those 20 hours yourself. So if you can marry that with our course at the same time, absolutely delighted for you to do that. If you can take it before you start the course, we recommend that because it sets your learning up. And perhaps will make it less busy for you. But really, you can, as they say, skin a cat in so many different ways. It's your learning, it's your exposure to that. And we really just want most people to feel this is accessible to them. So whatever feels comfortable for you, we'd be happy to facilitate.
Oh, there's another question with regards to the requirement of English proficiency. So maybe
That's a really great question. Yes, we do suggest that you meet the minimum. I think we've set it on the international, I think no less than 6.5 or 6. And that's really just for your comfort level. In saying that, a lot of the materials you could take and translate yourself, and you can actually put in subtitles into the videos. The only challenge you may have is when you come to the live sessions. If your verbal English, your fluency is a little bit worrisome and you're not so good on your comprehension, you may struggle at that point in relation to the class, the live sessions. But again, if you felt that you were able, we would look at that. We'd see how we could support you. The other thing, just to put it out there, is that we are currently working with our global colleagues, and we will be moving. I don't want to be too ambitious, but we will be moving to offering this course in other languages as we move into 2026. And we've given some opportunity to really test this course. So if you can wait and you would feel more comfortable in your own language, and we're looking to do that certainly in Spanish and Portuguese and maybe Arabic to start with, then please hold off. But that's all still in the planning. Anything else? Any other questions?
if they're already working in drug treatment centers and have treatment trainings, are they still qualified for UNAC?
Yes, I mean, I would say, if people have already taken, sort of UTC 1, 2, 3, 4, or you're even ICAP already certified and you're a nurse, what's different, we know there's a lot of core knowledge right across any discipline. I mean, there's, 1 and 1 is 2. So, drugs are drugs, certain expert is expert. But what this course does is it is all through the lens of nursing. So if you really feel comfortable in your role as a nurse and you really want to understand how to care for clients or patients that you're working with as a nurse, then we take all of that addiction understanding and we have put it through the lens of nursing. So the nursing process, how we approach nursing. So if you're familiar with your nurse training, you come already qualified. We're going to make lots of assumptions about your understanding and your professionalism in terms of nursing. And we're then going to show you, you already know how to drive a car. Now we're going to show you how to drive a slightly different version of that car. But that's all we're doing, is we're really helping you to translate some of your basic nursing knowledge, but then actually pivot that into addiction. Or if you have addiction knowledge, and you've just learned it through the generic addiction framework, we're going to show you how that is slightly just adjusted from a nursing lens. And for me, that's quite exciting. And I do personally, you would expect me to say that I think nurses do approach this subject in a slightly different way. And we add value to the multidisciplinary team as a result of that. And we would then show you those tools and that language so that you can elevate the nursing role with the teams that you're working with.
I also think it's an opportunity for you, especially if you've been trained on the unit, if you've been trained in the treatment center, in that environment, and lack formal education or haven't had a chance to really assess your own learning skills and your approaches. It's really about the approach. It's about the responses. It's about how to work with patients who need a little more than what's served every day. You know, it might help you respond in ways that you don't see practiced in your work area. And this is a really good way for you to like take 2 steps back and look. One of the things that all of the students have really appreciated being with other countries and seeing how they use different practices, and based on their culture or not, they just do things a little differently, and how that works. It really stimulates the whole way that you see your practice, because we all have ownership over our own practice. And I think it's really exciting to be able to step back and really look at, am I doing that? Is that the way I come across? Do I use those words that make me sound like I'm not really joining? So yeah, it's a challenge. I mean, I think you have to be ready to take a look. Not everybody likes doing that, taking a look at yourself. But
yeah, there's a lot of experiential work in this, which I think makes it quite dynamic. Certainly, Karan and I we were so reinvigorated and inspired when we did the pilot last year in Greece with the nurses that we met there from right across the globe. They were just wonderful colleagues. And I learned so much. So, you know, even old people like us can really, you know, stand to be exposed to new experiences. So we hope that we can pass on some of that enthusiasm to you. And just in response to our colleague who asked, is this going to be the same training as that's offered in Bali? Yes, it is. This is the online version that we're describing to you, but the content is also available in person, and we can actually run that as well. If you're interested in us dropping into your country or being sponsored in some way to come and do this, like any of the universal trainings, we can do that in person in your country. And we're very pleased to say that myself, unfortunately, Dr. Berda, my partner in crime, is unable to travel, but I have another colleague who is an expert nurse and qualified social worker who will be coming with me, Dr. Trish Hafford-Letchfield, and we will be running this course in person in Bali end of September at the ISEP Congress. So if you're already signed up to that, and I think I recognize the person asking the question is one of the participants, I'm looking forward to seeing you in person in Bali also. But if you're also just attending Bali and want to talk more about this training and aren't necessarily in the training itself, please do come and say hello to me. More than happy to have a catch up, cup of coffee, and talk to you about how we could ignite nursing addiction training in your institution, in your country, or in your part of the world. I'm just super aware we don't want to hold everybody. We're already slightly over. Can I thank, obviously, Verna, who is an absolute star as part of the ICU DDR team, who makes sure that we have these webinars and keeps us all on track. I particularly also want to give thanks to my colleague, Dr. Berda, for all of the support in this course. And we are just delighted that you've spent some time with us, and we're super excited. So please start filling in those applications, and we look forward to seeing you online and spreading the word and the mission. So thank you, everybody. Have a great rest of your day.
Thank you.
Thank you, everyone.